everyone. Welcome back. We thought today that we would tell you a personal story of something that happened to both of us. It happened primarily to me, but it happened to both of us. But just to kind of
She got the worst end of it.
I did get the worst end of it. But it was hard for her too. But it kind of tells you how medical science and nutrition are rather dissociated. And in no way are we denigrating medical science. It has come a long way and has helped prolong the lives of many people over the last few decades. People study a lot of years for their degrees and really are trying to do good. It's just that sometimes you have to use your own wisdom and common sense too when your doctor tells you something. And that's kind of where we're going with the story today. But after I lost probably around 170, 80 pounds in there, I started to get lightheaded in the morning. If I didn't eat or drink within about 45 minutes after getting up, which I normally don't, I usually get ready for the day, and then after that I'd go eat. In fact, when I was working, I wouldn't eat until I got to work, which was about 2 or 3 hours after I got up. Never had a problem. In fact, I was kind of the exception to every obese rule ever, because I never had a health problem. I didn't have high blood pressure, I didn't have high blood sugar, and I didn't have any heart disease, diabetes. I never had diabetes type 2, which is prevalent among overweight people. And so I was really very fortunate. It doesn't mean it wasn't coming, but I was very, very fortunate. So with all of that in mind, I lost all this weight, and I was getting dizzy in the morning. I noticed that after I showered and I was standing kind of doing my routine, blow drying my hair, all of that, it was about the time it would start to set in, and that I would get clammy and shaky and have heart palpitations. And I thought, well, maybe it's low blood pressure, because I had checked my blood pressure a few times and knew it was really low. And so I started reading up on that and trying to find things, and I even started to be careful in the morning to make sure that I didn't wait too long, but I wasn't careful enough. And last year, in 2017, on Martin Luther King weekend, I got up on a Sunday morning and we were getting ready to go to church, and I could tell that it was coming on. And so I stopped mid blow drying my hair, everything, and thought, go take care of this right now before it gets bad. And so I was going to the kitchen and to get something to drink or maybe even something to eat, and I got in the kitchen and my legs gave out under me, and
I'll take it from here for a minute.
Just a minute, not done yet.
Okay.
And my legs gave out on me, and I went down, but I was still lucid. And so then Sandy heard that. Now you can take it away.
Okay. So I heard this crash in the kitchen, and I was in the living room, and I said, "Is everything okay?" And she said, I just got lightheaded and I fell. And so I got up and went into the kitchen to check on her. And as I got in there, she was getting up. She had one hand on a kitchen chair and one hand on the stove. And she was kind of leaning over like this, kind of looking down at the floor. And I thought, okay, she's just getting her bearings. And then she just totally face planted on the kitchen floor. I learned a lesson that day. I'm not good in emergencies. What I did was run up and down the hallway saying things like, what do I do now? Do I call an ambulance? I don't know. How long will it take an ambulance to get our little rural town? Well, do I take her to the emergency room? How am I going to get her in my car? I don't know. So that's how well I handled that situation. By the time I decided that I should go back into the kitchen to see if she was still breathing, she was coming to again.
Yeah, so I actually woke up to hearing her going up and down the hall talking to herself, saying, I don't know what to do. What do I do? And so
and as she was coming to, there was this puddle of blood on the floor where her face had hit.
Yeah, I actually lost my 4 front teeth in that. These are all new, all of these. So if I lisp in these videos, that's why. And I actually used to lisp just a little bit anyways. I've never been able to say my S's right. And I even went to speech therapy when I was in elementary school to learn how to say S's, and I never have been able to say them completely right. So I always lisp a little, but it's worse now, so bear with me. Bear with me if it sounds like I don't know how to speak, because these are all new. They're bigger than my previous teeth. My dentist said that if we're going to do it, let's make them perfect, and I'm all for perfect. There might as well be something perfect. And so I lost 4 teeth that day, and it was a Sunday, And of course, my dentist's office isn't open, so Sandy got on the phone and he called her back, and it was actually a really busy day for him, unfortunately, but he absolutely found an hour for me to meet me at his office and told me they're going to have to come out because they were shoved back into the roof of my mouth. They were still in there, but they were shoved back, and I had braces as a teenager in the 1970s, and he said that because of that, in fact, he took x-rays that day, and he even told me, he said, I forgot that you had braces because evidently, especially when the way I did it, because we didn't have the glue-on ones, we had the brackets that went around the tooth, and evidently the braces have the potential of ruining your roots or shortening your roots, and that's what happened to me. I had hardly any roots. In fact, I had to go back. He couldn't pull them out that day, so I had to sleep like that with these teeth shoved back in the roof of my mouth. But when he pulled them the next morning, 3 of them just fell out. He just put pulled the little thing out, and the other one still had one root it was hanging on, and it came out. But so there's a lesson on all you people who had braces back in the 70s. But
it also could be a little bit, side note, it also could be a little bit of genetics, because we have a brother who has lost a front tooth
from biting into a corn on the cob.
From biting into a corn on the cob, and the dentist told him that his roots are really short. So it could be genetic combined with, we both had braces, but I didn't fall on my face. So it could be both. Anyway, go ahead.
Anyway, and a huge shout out to my dentist and his staff. They are the best, and I have a lot to say about all the help they gave us. But anyways, so I went through the process of getting a bridge. I had a temporary for a couple of months while because I had to wait for all the inflammation to go down in my mouth and let that all heal up. And so finally, a couple of months later, I was able to get the permanent bridge. And it wasn't until I went all through all this process that I actually even went to see a doctor, and because I was more worried about my teeth. I'm not going through life without teeth. I'm just not, especially my forefront teeth. And so I got that taken care of, and finally went to a doctor. And the doctor, I have no problem with the doctor. She was very personable. I really like her. I'd go back to her again. I don't go to doctors very often, neither does Sandy, because I do all my own studying to find out what things I can do on my own. But I do know that there is a place for a doctor in your life. So I went to her, and the day I went, I told her the story of why I was there. And I'd already eaten breakfast. I'd had a sprouted grain bagel with almond butter on it, and only about an hour and a half had passed, so I still should have been up. And the blood sugar should have still been up. And she took my blood sugar, and it was only at 70 after eating breakfast. And I didn't even know what that meant. I was on my cell phone looking things up while they were running in and out. And she and her nurse. And so she told me she couldn't let me leave, that I couldn't drive at 70. And that unless I signed a waiver, and that I would need to stay.
And yet she drove herself there.
Yeah, I did drive myself there.
Had we known this prior to that, I would have driven her there, but...
Didn't know that. Had no idea. Didn't feel any symptoms that day. Ate breakfast. So they made me drink well, they didn't make me, but they asked me to drink half a bottle of straight glucose, which I don't even eat sugar, so that was a weird flavor going down, but it was so sweet. And they tested again. And I was only at 76 at that point. So I heard the nurse go out she opened the door to the center part where all the medical people are, and she says it's 76, and the doctor said, tell her to drink the rest. So I drank the rest of the bottle. Got somewhere up around 130. I don't remember the exact number. And so the nurse opened the door and said, she's at 130, whatever. And the doctor said, yay! Everybody started clapping out there. So, and they give my doctor a lot of kudos. She made sure I got all the tests I could get. I had a pancreas scan to check for tumors on my pancreas, because that'll release extra insulin. In fact, there's a condition called insulinoma, which I learned during this process. She never told me that's what she was looking for. I got onto the internet and started looking up what they do pancreas scans for that have to do with insulin, and found out they look for tumors for insulinoma, which is almost always benign and easily correctable through surgery. They just remove the tumor. So it wasn't that big of a deal, but it could be malignant, but it's extremely rare. In fact, insulinoma is very rare. I don't even qualify for it, but still, she took precautions there. I had blood tests. She also wanted me to go to an endocrinologist because of the adrenal gland. And endocrinologist helps with hormones, and then the adrenal gland is a hormone, and it also can mess up your blood sugar, and my insurance didn't approve that one, so I never did that test. But the one thing she told me, and I guess this is the point of all of this, is she said you need, and now mind you, I've just lost at this point over 200 pounds by the time I got to her, and I've had a history of sugar addiction and all the problems, you know, that come with overeating, as far as not being able to stop. If I eat one cookie, I can't quit. I mean, if you give me a bag of Oreos and tell me take one, you might as well give me the bag of Oreos. I'm going to eat the whole thing. So I don't eat them anymore. And with that history in mind, she didn't know all that, though, but she did know I had lost all that weight, because I told her, and she told me, you need to drink a real Coke every day and make sure you have candy on you all the time. And I thought, that is counterproductive to everything I have ever learned or taught or know about myself. Not only that, but that's just treating the symptoms, which I appreciate that, you know, I do actually keep candy in my pocket, especially when we go for a walk. I never use it because I also keep dried fruit, but that is the extreme emergency, is that I keep a piece or two of hard candy in my pocket in case I get lightheaded while we're out. And I haven't yet, and I do carry around dried fruit as well, and I take a lot of precautions. But again, my question was, what was causing the low blood sugar? I don't necessarily want to treat the symptoms, and that is where I kind of become disassociated with modern medicine, is that they treat the symptoms, and I want to know why something is happening. And what we
cure
do,
the problem.
Cure the problem. It's fine to fix the symptoms until you can cure the problem, if that's how you have to live, but not long term. I want to cure the problem. So that was when we got introduced to the lady we call our voodoo doctor. She's really a natural practitioner, but we call her our voodoo doctor. And she did all sorts of things and told me all the things I was allergic to. And I talked to her about, she told me I was really high sodium. And I said, well, that's because I drink a lot of diet soda. And so we talked about that and artificial sweeteners. Turns out I'm allergic to artificial sweeteners except for stevia. And with that in mind, it still took me 2 months after that visit to give up diet soda. But so I went home, started studying, because that's what I do. When somebody tells me something, I go home and I read everything I can about it, because you have access to the internet. You might as well use it. And so I found out that artificial sweetener can really mess with your blood sugar and cause all sorts of insulin release. And it took me 2 more months, because I love diet soda, but I gave it up cold turkey, quit, never have had one again, and that's been 7 months ago. And actually my blood sugar's a lot better since I did that. So that just shows you how the things you're taking in, we really didn't think that, I knew diet soda was bad, but I didn't know it was that bad. So we learned a lot from that we thought we were going to take one vice with us to the other side when we go.
One nutritional vice.
One nutritional vice, not anything else. But
yeah, just one nutritional vice. We didn't want to give up our diet soda, but we both did it.
Yeah, Sandy did it with me, because she decided if it's bad for me, it's bad for her.
But I have the sensitivity to artificial sweeteners as well. We both found that out when we went to the natural practitioner / voodoo doctor or herbalist. We both have sensitivities to artificial sweeteners, so we both gave it up. There have been days when we thought, that might taste good. Usually only when we're coming back from town or something, because that's when we used to get it. But it actually has been remarkably easy.
No withdrawals.
No withdrawals whatsoever. It's been an easy process. So I guess the point is that, well, there's a lot of morals to this story, but one of them is, it's not as hard as you might think. Whether it's with your diet or with your diet soda or with whatever it is, it's not as hard as you think it will be.
No, it isn't. And the other part, and really what the message that we want to convey, and we have more stories to tell, we're not going to tell them all today about dealing with medical science and our own research, but do your own homework. You're in charge of your health. Regardless of what your doctor tells you, go home and research it. And I'm not saying your doctor isn't right, nor would I ever tell you not to go by your doctor's advice. But do it with your doctor. Don't just walk out of there with a prescription. Now I sound bossy, but do
Again, we can be bossy, but we're not being bossy today.
No, and this is our own experience. Again, we have no medical background, but it's our advice is that we have found that you can be your own advocate, do your own research. it did not sound right to me to start eating candy and drinking a real Coke today to fight low blood sugar. And so I found out on my own and took other things into consideration and have tried other ways of combating it. And this is where we're at. And actually, I'm doing a lot better. Still carry around dried fruit with me and then keep emergency hard candy in my pocket. But I've actually only eaten the hard candy maybe twice. I usually give it out at church to people. So that's our story today. Well, please leave us a comment. Let us know your stories and anything you've found or anything you want to know. We'll look it up and see what else we can learn.
Give us a like and subscribe.
Thanks for joining us.